Okay, hi, I'm so excited. I get to
Yeah.
be here with
Yeah,
you.
this is awesome. I know we've been talking about this for a while
We
and
have.
finally put it on put it on the books, and
Yeah.
I'm excited for the conversation.
Yeah. I think I've found myself in this unique space of the beauty and aesthetics, where women, we are just having this conversation younger. The facial rejuvenation conversation is happening younger. There are so many non-surgical options on the market
Sure.
that we want to stay looking better for longer. And when does surgery kind of come into play?
Yeah,
Like, that's the big question.
I think the reason for that also is we are just, you know, consumers are just inundated by options out there.
Right.
And so they're well informed, they're starting it a little earlier, they're more aware of taking care of themselves. And so, you get to a point where some of these non-surgical options don't always give you that same improvement that you're looking
Right.
for. And the problem there is if you keep doubling down and doing more of it, you open yourself up to more risk. You may not get the same results you're looking
Yeah.
for, and things change.
It
And
can distort.
it can distort.
Yeah.
And I think that's where you have to say, I'm going to transition from, the needle to the knife and
Yes. Oh, I like
really,
that.
really think
Yeah.
about surgery. Because what we're doing with surgery is, it's not about looking overdone. It's not
Mm-hmm.
looking fake, if you will.
Mm-hmm.
And I use that word carefully because I hate that word
Mm-hmm.
realistically. It's about kind of restoring
Yeah.
your anatomy so you look rejuvenated.
Right.
Um, when you start doing non-surgical stuff and it doesn't look right, you got to ask yourself, maybe it is time for a surgical approach.
And I think it's hard for women to really be able to see themselves objectively and really know, like, hey, I've crossed that line.
Right.
Thankfully, we all have people in our life that'll be willing to
Right.
tell us
I mean, it
for the
really
most
is.
part.
Sometimes it's our responsibility
Mhm.
as the doctor or sometimes the injector. It's hard, like it may not be their wheelhouse and they have to recommend you to somebody that does do that.
Right.
But I think it's important. Otherwise, if you just keep using that one tool again and again, it's not going to give you that result. And you're going to open yourself up to problems down the road.
Right. I think that we live in a day and age where prior to kind of social media, internet, everything was very secretive.
Sure.
It was like this, people
Right.
weren't talking about it, but also we didn't know our options as the consumer. It's kind of like we go to the
Yeah.
doctor. Now, I mean, Joe Schmo can know what a
Right.
deep plane
I
facelift is.
mean,
And who was saying that 20 years ago? Who
no
was
one
saying
was saying that.
no one was asking the doctor what type of facelift
Yeah.
they perform?
That's so true. People were just saying, I want a face neck lift or I want to look like this. No one was actually aware of the techniques.
Right.
Everyone's aware. Like when I have a facelift consult, like they want to talk about the technique. They want to
Yes.
know, they want to know the details. They want to know the recovery process because they've
Yeah.
all been prepped, which is awesome. It makes for
Right.
a really well educated, informed patient. But,
Right.
we're far beyond like just the idea of I had a facelift,
Yes. Yes. I mean, everybody's the expert. I don't know if it's always, you know, a
Yeah,
good thing.
sure.
But I think that the plus side of being educated is that we yeah, we get to filter out, we get to know what we're getting. I think it sets the patient up for more realistic expectations if they know kind of the technique behind it. I
Sure.
think the flip side of that is now we have surgeons marketing their techniques, and
Right.
you and I were talking previously about there's only so many ways you can skin a cat. That's probably a bad analogy.
Sure. You're right. There is so many ways. And at the end of the day, you know, we understand the anatomy of the face, we understand aging, and there are a variety of options you can do. Now, when you start seeing kind of like trademarked, surgeries for a certain approach, that's really, in my opinion, a combination of a lot of the
Yeah.
techniques put together that that surgeon is doing. I wouldn't say it's anything unique per se,
Right.
but it kind of lends into this marketing of where you're thinking you're getting something very unique and special, and that's the only person that can do it.
Right.
And I think there's got to be some transparency here. It's like I'm not going to give the names of the procedures, but if you say this is like the magic lift, right?
Yeah.
And there's really nothing like a magic lift out there,
Right.
but you got to ask yourself, what exactly is it?
Yeah.
Is it a deep plane facelift? Is it a endo brow lift? Is it your eyelids done at the same time? Is it
Right.
fat transfer? Is it a laser? It probably is a combination of all that, and now it's called the
And
magic
they've
lift.
packaged it really well.
Yeah,
We talk about that all the time. kind of on my end, we talk about that like in regard to lasers. Someone will say, well, have you done XYZ? And I'll say, well, what type of laser is it? And they'll be like, I have no idea.
Sure.
Well, it's only one of several technologies that's out there.
Right.
It's probably radio frequency microneedling. It's non-fractional. It's
Right.
ablative, whatever it might be. Don't get caught up in the name brand. At the end of the day, the same thing I say about lasers is that it's the technician wielding it. It's the same for the surgeon
Yeah.
performing it. If that surgeon happens to be you like his or her outcomes, at the end of the day, it doesn't really matter their technique
Sure.
unless it does to you, but ultimately you can have five surgeons performing the same technique and it will look different because there is artistry involved with the
Exactly. That's
science.
so true. And at the end of the day, we can all trademark our own procedure
Sure.
because we're all doing slightly something different. You
Yeah.
have 10 surgeons in the room and you're all doing one procedure. Everyone's going to do something slightly different
Sure.
because it works better for them. They like the results, their patients recover better. And that's really the art and science in plastic
I
surgery
think
where
what
it's
you're
like
telling me is that you want me to come up with a very cool name for your
I
surgery
think
because I
so.
am on it.
I would say so because at
It
the end of the day,
is.
everyone's doing
Okay.
it at this point. But,
Right in.
I mean,
What should we call Dr. Yash's?
right, not the magic lift, of
Not the
course.
magic lift,
Yeah, but
although
I mean,
it
but
will,
that's
it's
true though.
catchy.
It's gotta be
Yeah.
catchy, it's gotta be attractive, and it's I think there's gotta be some honesty in what it really
Yeah.
is. As a plastic surgeon, I love just being very transparent. You are getting this procedure, and it's like an anatomic name for
Yeah.
what they're getting done.
Yes.
I think patients like that sometimes, they understand it. There's no smoke and mirrors, they know exactly what they're getting
And
because
marketing works. It
but it
works.
does work.
And it makes the patient feel like they are getting what they pay for.
Sure.
And that's not always the case. We know that. There are surgeons that are much better at marketing than they are at
Doing
surgery.
surgery?
I think I've come across that. I've experienced that. But ultimately I think being aware of what your options are as a consumer
Right.
and then, finding a surgeon that really understands. I would say that for my demographic, most women prior to like the millennials, like they were waiting till their 50s and 60s to get
Sure.
a facelift. And now we're seeing that younger and younger. In fact, I sent you one where it was the girl that was 34 that had
I
had
saw
the
that, yeah.
facelift.
34 years old, full facelift.
And what I would say from the generation in front of me is I'm seeing a lot of fat transfer to the face, and it's
Right.
too much. It's not my aesthetic.
Sure.
But I'm also seeing a lack of snatchedness, if you
Yeah.
will. Whereas I think women we want a balance between a natural result and but also like,
You wanna see a
I
difference.
want to see a difference.
Right.
I want that V shape taper here. And so it's like I don't want, there are some that are too far where, their eyebrows are now in their hairline. I
Right.
don't want that. But I don't want my face to necessarily look
Right.
bigger.
Sure.
We were talking about an interesting
Or
thing,
wider, right? Yeah.
or wider. I don't want a wider face here. I want this to be pulled, I don't want it extreme, but I don't want it, I don't know how to,
I totally get that, and I'll tell you with the face, there are places where you should really, accelerate on the gas pedal a little bit to get that result that you're looking for, and
right.
there are places where you really shouldn't. And in
Sure.
my opinion, the upper face is where you don't wanna be aggressive. That's where you're really gonna look different.
Yeah.
You're gonna look overdone. Like you said, your brows are gonna be in your hairline. It doesn't give off a natural result, and people don't want the exaggerated results there. They want
Right.
it down here.
Right.
The
This is,
neck is really where they wanna see a big
I
difference
will
there.
tell you, when I look at facelift results, there are two places that I'm really looking. And I think the brow, to your point, is more trendy.
Right.
That is a trend thing that I say, be very wary of distorting the anatomy there. I think that that is not going to age well. I don't
Sure.
want to see my grandma that's 80 with
A Spock eyebrow or
like a
anything like
very
that.
fierce brow. But I do think you can't go tight enough on the jawline. Where it's scary is when it starts to get into the
Right.
mouth,
Exactly. The mid
pull the
face. Yeah.
mouth.
It's gotta blend here. If it's kind of translated from the neck onto the face, then you start also
Yeah,
looking a little different, right?
right.
And that's where you have to really be careful of what you're doing.
And they're all connected. So, if you're pulling here and you want it to, the way that it's more natural is not like necessarily how much skin you cut off or
Sure.
whatever. It's if everything is in harmony. We
Everything's
talk
got to be
about
done
that all the
together.
time.
Exactly. And there's different techniques in the facelifting.
Mhm.
I think if you just focus on one area or do more of one aspect of the facelift, that's when you kind of have
Agreed.
maybe a result doesn't last long enough, it doesn't look as natural, or you may not like it at the end of the day.
Yeah. Yeah. So, when it comes to the lower neck, and when I look at facelift results, when I look at surgeons that are kind enough and patients that are kind enough to, that's a hard thing,
Yeah.
right? To get patients to agree to let you post.
Yeah, I mean that's like my biggest challenge with my facelift patients is,
Right.
I get it. It's your face. You want to be private about it, and
Yeah.
so most of my patients, won't consent
They
to
want to
that.
be private. And I get it. As somebody who puts themselves out there, you really do leave yourself open for ridicule.
Yeah,
Um, when it comes to the lower face, that's what I look at for surgeons. If they still have the jowling
right.
and they still have the pulling here, I'm like, that isn't what I want. And I'll tell you, we talked about it, is a lot of my community,
Sure.
they're women that are taking very good care of ourselves.
Sure. I mean, that's the
So,
testament to you, right? Because you're sharing your experience, you're telling them what's good, what's not
like,
good, and
hey, that's not worth your money. And so, there's a lot of surgeons, maybe some older surgeons that'll say, no, like that, why that you're not, and I'm like, do I have to wait till it's so bad that you would take me on? Or can we address things like jowling
you may never get
and
there,
pulling?
right? If you're going to wait for that long, it
Right.
it may never happen. And does that mean you can't get a procedure? No, I
Mhm.
think you can definitely do it at that time.
And I
Just
think it's these surgeons that are really have made a name for themselves, really want these wow factor before and afters, which I totally appreciate. But, me and my friends, me and my community, we want to see more like, hey, she went from a 9 to a 10.
sure.
She went from an 8 to a 10,
I agree.
you
It's the
know?
conversation you have to have.
Mhm.
Like, yes, you can have something done. And I think typically when you're at that point, let's say you're like a 7, 8, or 9, like not every aspect of your anatomy is really aged.
Right.
And so that actually lends it up for like a great operation where you don't have to do a lot of things, but you can do the right things to
Mhm.
really restore and get that result you're
Yeah,
looking for. I think you recover better when you're
I
at
do
that
too.
point.
Yeah.
When you're doing these big wow surgeries, they're awesome. They're a lot of work in the operating room when you're really restoring the anatomy. You
Mhm.
really have heavy jowls, a heavy
Yeah.
neck. It's a lot of time and recovery there. And no two patients are the same. And I think the patient you're talking about is not the same patient that these other surgeons are talking about either, right?
I
So
agree. And I think that's what I'm really hearing kind of in my world is, okay, what does this look like? I asked some of my followers some questions.
okay,
Someone says many surgeons recommend avoiding fillers before getting a facelift. What is Dr. Yash's opinion?
definitely. I don't agree with that. I think it is totally fine to have fillers done before a facelift. I mean, if you're waiting to do fillers, in my opinion, I would say the reverse. If you're starting to do fillers after a facelift, I'd say maybe something was not done during your surgery, because
Yeah,
you shouldn't be jumping back to non-surgical augmentation right after a facelift. Because you should be able to have a period where you're actually enjoying the results. You don't need that volume.
right,
So fillers to me have a role when you have good internal support for your face,
right.
when you have good quality to your skin, and you're really just addressing volume. That's really what it does. When you start getting to a point where other parts of your aging has happened, fillers may not be the best option. And
Sure.
so it's really, in my opinion, it's an early treatment. It's a bridging treatment.
Yeah,
Um, there's a role after a facelift as well, but definitely I wouldn't say wait till after a facelift.
right,
Surgeons may say that because when you start doing fillers before, it makes the operation a little more challenging.
right.
You got scarring, you got inflammation in different areas, especially if you're not injecting in the right place.
Mhm.
So yeah, I get it. It's not a straightforward slam dunk
It would be
primary
easier for
facelift.
you.
Sure. But I think that would just be the wrong thing to do, is just to not encourage anybody to do all these great things that are currently now on the market
Right.
and then jump to a facelift,
Right.
right?
We
Without
talked
trying it
about it a
out.
little bit before. There's a saturation point.
Yeah.
And you said it fillers are augmenting. They're not lifting. No one goes in for a breast lift and says, just give me breast implants. Although there are some doctors that say that, which really, really gets on my nerves. But implants really aren't going to lift the skin. They're going to make,
They add volume.
they add volume.
Right.
And that's the same thing with fillers. It's like If you had a balloon, like a really tiny balloon, you start to fill it up, the balloon's nice and tight. But if you start filling up a water balloon on this like a sack,
Right.
if the integrity of the skin isn't there,
Right. And you're right. It's three-dimensional. It's not
mhm,
two-dimensional, right? Filler, you add volume, then there's gravity. And there's a lot of secondary changes with lymphatic obstruction and how your tissues
yep,
actually breathe that early on may look okay. And in 6 to 9 months, maybe even after 2 years, things start looking a little different.
it's
So
true. Yep,
it's volume augmentation. The other thing about volume with fillers, it's not always anatomic replacement. So when we lose volume in our face, when we do fat transfer, we're gonna carefully refill that area that's lost. With filler, you're injecting in a different place because you
sure.
can't always inject where that volume is lost. So, you have to know how to do it well, and a good injector does a great job. It's
Yep.
great, but there's a
It's not a
point.
replacement for surgery.
Exactly.
Now, when we talk about facelifts and fat transfer,
Right.
isn't there also just fat repositioning where the fat necessarily hasn't
There is
atrophied,
actually. We
but
don't. Yeah.
it's just
We don't
moved?
talk about that as much for facelifts, but there is
Mhm.
a powerful aspect to a facelift, a specific type of surgery that we do. Like there are different techniques in facelifting, but if you're elevating the deep layer, the
Mhm.
SMAS, and you're lifting it back up to where it is, you are repositioning a lot of your superficial fat, you know, parts of your jowl, you're repositioning it back up into kind of the mid cheek hollowing that's happening. It's true for eyelid procedures as well. So there is a powerful aspect there to where you don't need a lot of volume with
Right.
fat transfer. I think I actually wrote this article comparing all the different facelifts, and
Mhm.
we analyzed before and afters for a lot of prominent plastic surgeons from the last like 2 decades, realistically.
Mhm.
And we looked at their different, they all had different techniques. Some of them did fat transfer, some of them didn't. You couldn't really tell who did what, but the idea is you have to know how to use the fat transfer and you're using it differently in different techniques. So
Yeah.
you can't just kind of willy-nilly inject the face with a
Right.
lot of fat if you're doing some of these other techniques where you're actually repositioning the fat
Right.
already.
Because there isn't quite as much fat atrophy as I think we've been led to believe, that you just kind of like start losing all of this fat. I look at my mom and the patients that live in her little
Sure.
home, and I'm like, they're not all just gaunt
They're
skeletons.
not. I mean, everyone's got a different,
Mhm.
genetic makeup to where some
Right.
people will age faster, some people will have more volume loss, some people don't. And it's you have to know if you have good volume, like why are we just injecting the face with a lot of fat there then?
And I think that that's the role of a good surgeon, is
Sure.
to not just have this one technique, but to be able to adjust based
Right.
on the patient's anatomy.
I agree. I think with facelifting, you have to have all your tools available,
Right.
and you have to know how to piece it together. You do
Mhm.
more of one thing than another in every patient. It's not like you're doing the exact same thing for every patient. And I think
Right.
that's what gets you the right results.
Right. Totally agree. Okay. So this is an interesting one. She's asking, how would you treat dimples during a facelift? They were cute when she was young, but she doesn't feel like they're cute any longer.
Interesting. So I would say for dimples, it really has to do with the full release. And so if they have kind of like the mid cheek dimples, some of that's anatomic where they have their dermis kind of tethered down
Hmm.
deep, and some of it's actually an osteocutaneous ligament where it's actually going from the bone all the way up to your skin. So when they smile, the muscles are animating, but that dimple kind of pulls it back, so it looks cute. They want to get rid of that. You have to release it, and you can release it deep or you can release it superficially, and then you want to camouflage a little bit with a little bit of like nano or fractionated fat so it doesn't kind of scar back in. I
Yeah.
think that's your best option, but that's at the end of the day, if you have anatomic dimples from like childhood, it's there and you have to release it. So if you're not dissecting over there,
Hmm.
you're not going to get the improvement.
Can you do a facelift and leave the dimples?
You can.
Okay.
You definitely can. You have to be careful where you're releasing, and you want to be careful not to dissect in that zone.
Yeah.
At the end of the day, most dimples are pretty close to the corners of the mouth sometimes. So,
Hmm.
in my opinion, you don't want to dissect all the time in that area because that can pull that a
Hmm.
little back and that
Hmm.
it may not look natural.
Yeah.
So, you have to see everyone is a little different. And but if someone has dimples and they want to keep it, I would be careful not to really release that for them.
Interesting.
Yeah, that's a unique
Okay.
question.
Yeah, it is a unique question. So, if you have a very lean patient that does need facial fat transfer for the whole face, what would you do? How would you address that?
With the facelift, if they're truly needing a facelift, the way I do my fat transfer, I do my facelift first in the operation, and then I do my fat transfer at the end. A lot of surgeons may do it in the beginning of the operation. It's surgeon's choice. The reason why I like to do it that way is because once I've lifted everything and brought it back up, I can then see, okay, this area needs a little bit more volume.
Right.
And I think I end up injecting a little less than I normally would. And I like that
Yeah.
because I think the smaller volumes you do for fat transfer, the higher take you actually have for that
Hmm.
fat. And I just think the right amount of fat is all you really need. If you
Yeah.
overcorrect and you really make the face a lot more plump, it's a different aesthetic.
It is
And
definitely, and
it's
one
like
that I do not like.
right. It's a lot of my patients don't want that.
Yeah.
They want to see a narrower face, more angled face.
There was a wave there for a while where these patients were coming out of a facelift, and it was, you and I discuss it. It's an optical illusion almost. I don't feel like they're removing as much skin and pulling as tight if they do the fat first. There was just this aesthetic with facelifts that you could just kind of tell who did it, and it was just not for me. I think it also goes back to that repositioning of the fat. If you do it afterwards, you see that, okay, I've restored the fat into its original place and it's doing its job again.
I think it works well for me. I think everyone's got a reason why they do it a different way,
Hmm.
but I think in this sense, I think it makes a lot of sense for me.
You can let them know, like, I
Yeah.
am fully on board with your
Yeah,
way.
yeah, for sure.
Let them know, like, okay. um, so of course we have, how early can you get a facelift? Is earlier better?
Earlier is better for certain things, for like a variety of things, actually. Recovery, I think you recover quicker, you recover better if you're having a facelift 10 years before you were thinking of doing it. That doesn't mean you have to do it 10 years earlier. Definitely not. But the point is, you have better quality tissues, you have better canvas, so you're going to heal quicker, you're going to recover quicker. That's nice. I think as far as how you look, I think you do end up looking a little bit more natural when you have your procedure done slightly earlier than later. So there are some aspects to doing it earlier that are better. Um, if it's on your mind, if there's certain aspects that you see at this point in time, and you're saying, I don't want to do it at this age, I'm going to push it off 10 years, I would say think about it because you'll enjoy the results for those 10 years versus kind of perseverate over, I'm doing a facelift in 10 years.
Right.
And what can I do right now to just kind of push that down the road?
Right.
Let's do some filler, let's do radio frequency. And at the end of the day, I'll tell my patients this every time. You're not getting a surgical result if you do these things.
Mhm.
I think the biggest mistake is when we tell our patients, do this great laser, this great radio frequency device. It's new on the market. It's basically doing what a facelift does for
I
you.
hate that.
You can't, they're not the same. They're apples and oranges. I always tell my patients, if you do this, it's fine, but you're not going to get the same result as a surgery. And I
Yeah.
show them like this little chart and I'm like, this is surgical result up here. This is kind of where the non-invasive is, and
Yeah.
this is doing nothing. So, ask yourself, where do you want to be right now?
Absolutely. I think that the term non-surgical facelift is probably one of my biggest pet peeves. Like, there's one thing that surgery cannot address, and that's skin quality. And so I'm always telling people, like, yes, invest in the lasers for
Right.
skin quality. It's not going to lift your jowls. It's not going to tighten the skin ultimately. It's not pulling anything up. But there's a place for that, but it's not going to replace surgery. And the other thing is, there is uh, nothing's forever.
Right.
So I
Aging is
think,
nonstop. The moment you leave that operating room, you're aging again,
yes,
right?
and I
So
so I think that the idea is, I'm going to prolong this so that then I don't have to do it again. And I'm like, here's what it's going to do for you. Let's just say theoretically you are lucky and it sets you back 10 years. You look 10 years younger. You will always look that 10 years younger.
right.
Even though you'll still age,
Yeah.
you still get that margin back.
Yeah, and we've seen this like with our own family members over time. People age at a different rate at different points in their
Yeah.
life. And early on, their aging is a little slow, but there's a point where they really
I call
accelerate.
them age spurts,
Yeah.
like a growth
Yeah.
spurt.
I like that.
You do.
It's
You
so
have an
true.
age spurt. I think it's 45 is a age spurt, and then 60 is the other age spurt. So
And that's going to happen regardless. I do think people age a little better and slightly differently if they had a procedure
I
because you
agree.
are supporting your repositioning. And in my opinion, I've seen patients have a different type of aging.
Yeah.
after a facelift or
Yeah.
after a procedure done,
Yeah.
which is not bad. It's actually good. You can tackle some of the secondary aging slightly differently. It
Mhm.
doesn't have to be surgery at that point in time.
No, I totally agree. I think I mean, anytime you excise skin,
Right.
um,
It's not growing back.
it's not gonna grow back. It does relax. It's still, I mean, even a tummy tuck, a breast lift,
Yes.
especially if you gain weight, lose weight, but ultimately it will always still be tighter and firmer than it was
Yeah,
prior.
I'm always impressed when I do a facelift how much skin I'm removing. And sometimes I see a patient, I can totally predict this one's going to give me a lot of skin when I
Yeah.
actually elevate the deep layer. And some patients, I'm like, wow, I did not really expect that.
Yeah.
But you know that that's never coming back.
Yeah.
Sure, you'll age a little bit for sure, but that skin doesn't grow back.
No, and that's yeah, to that point. I heard a surgeon talk about it, that what surgery is like tailoring your pants. You're
Right.
making them fit you, but what it can't do is steam out the wrinkles. You're just moving at those deep
Yeah, that's a good point. I
deep
like that.
wrinkles. And that's where skincare, skin quality, lasers, those come in. And so I think that if women start to change their thinking, and another thing I always say to people is like, you can't be so desperate for a fix that you're willing to buy snake oil or you're willing to believe whatever someone's selling you.
There's a lot of stuff out there.
There is. And it ultimately they're preying on your desperation. You cannot be so desperate
Right.
for, an answer that you're willing to fall for
Right.
anything.
There's no one magic, potion out there. There's
No.
no one, groundbreaking science that is changing, aesthetic
Right.
world.
Right.
You got to be realistic. And
Yes.
I think what really holds up is consistency,
Yeah.
hitting the main pillars of skincare, both
Mhm.
before and after any procedure you
Right.
have done. It's, sometimes you get a patient that's like, maybe listen to you or somebody else, and they're staying true to it before, and they have a great procedure and they have a great recovery. And then there are patients that are like, okay, I've never done anything. And now I've done this major procedure. What can I do to kind of maintain? And that's great too. And then they
Yeah.
start afterwards.
Yeah.
But there's not one fix for everything.
Unfortunately not. But a lot of times for me, the way that I wrap it is, how can I, instead of like just completely reversing everything, is how can I slow this down? And how can I just age better? And I think that if you start even thinking of surgery that way as well, that it's not going to stop things,
Yes.
but it will slow down. You are going to give yourself a leg up.
It's a point in time. You're so right.
So let's talk about the surgeries out there, and they all have cute
Yeah,
names. But ultimately, let's talk about what is, I believe, an endoscopic facelift.
sure.
The ones that you can't see scars.
Right.
The scars are back here. Let's talk about those and who is a candidate for it, because I believe it's just a really
It's a
small.
small, it's, I think when we talk about the face, sometimes people get a little confused as to like what exactly it's doing. But when we talk about something in the abdomen, they get it, right? Because everyone's heard of it for a longer period of
Yep.
time. So a full
Hmm.
tummy tuck or a mini tummy tuck,
Yep.
right? It's like those are two good options. The mini tummy tuck is really for a small percentage of patients. And I think,
Yep.
the endoscopic facelift that we've now heard more about in the last 5 years, I
Hmm.
think I tell you that it's really that patient that doesn't have it's a younger patient for sure,
For
in
sure.
my opinion,
Yeah.
someone that's probably taking care of themselves, has good quality skin,
Hmm.
good canvas, good envelope, but they're seeing the anatomic changes with the structure of their face. So they
Right.
want more defined jawline, a better neck angle, more malar
Yeah.
highlights, maybe supported brow a little bit. And that's where an endoscopic facelift could maybe help them, where you're hiding the scars behind the hairline so you don't see that, and you're supporting it internally. Um,
Right.
Thread lifts are kind of like the superficial procedure
Hmm.
that I really don't
I
recommend.
don't
And I don't
either.
do that a lot, but that's one of
I've
those
done
things
them and
where
I would never ever do it again.
I've seen patients with unnatural tethering from a thread lift, multiple thread lifts, and during the facelift, you're literally just cutting it and removing all of these, or you're taking out the scar tissue.
And to your point, if skin needs to be removed and you're doing a
Right?
thread lift, where's that skin going?
It's not.
It's almost an optical illusion when I see the before and afters, because it's the swelling.
Right. It's a filler effect almost. You're
Yes.
getting a filler effect, you're getting some sort of
Yes.
pulling. And sometimes if you do enough, it can look somewhat natural,
Yeah.
but it can definitely lead to a lot of problems. But this endoscopic approach is somewhat more of an internal supportive, you know what I mean?
Right.
And that's what it really does. So it's not a lot of patients are candidates for it, but a small number of them could be.
So, for instance, with me, I feel like I might be able to be an endoscopic candidate for mid face.
Sure.
I don't know, can you go deep enough to address nasolabial folds with an endoscopic? Because that's
It's
far.
a far dissection. I
It's a
think
far
with all these
dissection.
procedures, we talk about what you can do, but we also don't talk about what you don't want to do. And you don't
Right.
want to cause any harm. You don't want to have any deformity. And there's some really critical structures that you want to stay away from. And so when you start operating in kind of a blind space or in a very narrow space,
Because the endoscopic is like a tunnel, right? You're just
essentially you're
taking a
making
tunnel.
small incisions, you're kind of going in a very fixed space and you're trying to release and dissect. And at the end of the day, when you're repositioning things, you have to release areas as well, because if
Yeah.
you don't, then that's when you get unnatural contours.
Isn't that what this would be?
So
Releasing this?
the nasolabial fold is kind of just a secondary effect of what I would say is mid-face, internal support laxity and
Yeah.
then persistent volume here. We all have a little bit of a nasolabial fold.
Yeah. I did, like
um,
my toddler did.
Right. And so correcting it isn't, you can't release the nasolabial fold. I think surgeons at some point were directly excising it, leaves a horrible scar. And I just you can't really always 100% erase it, but you
Okay.
can improve the contour of it by
Okay.
supporting the midface and volumizing the face a little bit as well.
Mhm.
Endoscopically, I think it's a big challenge when you want to really get all the way over here.
Yeah.
So you got to weigh out the risk and the
Yeah.
benefit here, honestly.
So what I was saying is I think if I could be a candidate, I'm going
Yeah,
to tell you what I
sure.
this, but I don't think for my neck.
Yeah,
I already have loose skin, and even doing this, I can feel the skin bunched up. So I don't even know how you would really address it. So when I see those surgeries that they're like the scarless facelift, is it really scarless if they addressed the neck?
I think some of it's a little marketing. I think
Okay.
there's no procedure without a scar. You may hide the scar in a place that you can't see, hence it's scarless.
So it would be like back here, but would it
Probably,
still have to go in front of the earlobe?
probably in the hairline. There may be one right behind the earlobe,
Mhm.
allowing access into the neck to actually do work. You have to be able to get there somehow.
Right,
So in that sense, it's the question is, what's the definition of scarless? Is it scarless if you can't see it,
right,
or is it truly scarless,
right,
right? And so
right.
I think it's more of the first, that it's scarless because
Yes,
you can't see
you
it.
can't
It's
see it,
like
which I think that
rhinoplasty.
that's fine.
Yeah, sure. I think that's totally fine. When people
Yeah,
say scarless rhinoplasty, they're still making an incision inside the nose. It's just not on the
right.
outside. So hence scarlet.
Exactly. So I think that too, when it comes to neck, I would say that so many women say, can we just do an isolated neck lift and
Yeah,
not the face? But here's the problem with that is that once you pull here, if I'm pulling the skin, it will pull my mouth down if we're not also
yeah.
addressing the jaw on top. I mean, because it's the knee bones connected to the thigh,
Yeah,
but you know
it's
that.
totally it's one unit.
Yeah.
I think there are some patients who are great isolated neck candidates.
Mhm.
Realistically, those who are considering like neck liposuction, which was also has become a big
Yes.
uprise.
Yes.
And neck liposuction is great, but the problem is you don't address the skin, you don't address the architecture of the muscle. And so sometimes doing just an isolated short scar neck lift for that patient who has a full neck is a great option, because the alternative is doing liposuction, maybe getting some improvement, and then by 6 to 9 months, once that skin relaxes, it
Mhm.
just kind of falls.
Yeah.
That's a great patient. But then those who are looking to improve the neck just from the
Skin and
get-go,
no fat. Yeah.
you're gonna see some changes up here in your face. And it's all about the redraping. If you do it
We
together,
want it up, not
right.
back.
If you do
So
it, yeah. If you do it together, I think it's a better way to do it.
I agree. I agree. I think that and I would say I have this question a lot, when I show the mommy makeover you did for me, people
Sure.
are like, "Oh my gosh, you look so good, but how do you feel about the scar?" I'm like, "Well, I'm on the internet seen by like I think it went to like over a million.
Okay.
I think I'm okay with the
Yeah,
scar. Like I
clearly.
just
Yeah.
showed, you know, i- it's a weird thing. I think prior to actually doing it, the fear of it is greater than the reality.
Right. I think that's so true. I think the biggest downside to any procedure is the scar. Where is the scar? How good does it look?
Yeah.
And I think the thing is, whatever technique you do, if you can get that scar to look as nice as possible, to
Hmm.
fade and to heal naturally,
Right.
imperceptibly, anyone would sign up for that procedure.
Yeah.
And I think that's really what you need to do, focus on with any surgery, whether it be your abdomen or your face, is
Mhm.
you want to get it to a point where it's not so it's there's the benefit to getting all the contours and the final look
Yeah.
that you want. That scar's got to heal well.
Yeah.
And I think that's what's going to make patients want to do that procedure.
Yeah. So I have to tell you, I, have a following and I will occasionally run into followers, and I have run into 3 of your facelift patients. Like, right after surgery.
Oh wow.
One of them, like, very recently after surgery. She looked phenomenal. She's like, "Look, I just had a pho" I'm like, "Are you kidding me?" She looked so good. So, of course, being me, I'm like, "You have to show me all your scars." I mean,
Okay.
it looked amazing. I think that that is probably one of your skill sets
I
is
focus on the scars a lot. Endoscopic approaches we talk about is like it's great you can hide the scars, but at the end of the day, a lot of patients need the true procedure, and your scars got to heal well. And I think
right.
it's not just how you close the skin, but it's what you did during surgery to maximize blood flow to your tissues, to minimize trauma to your skin,
Yeah.
and to safely get that result that you're looking
Because the
for.
healing part is also so important to the overall aesthetic of the surgery.
It's half of it, in my opinion.
Yes, it's you can only do so much if someone is not healing well. There's there's
Yeah,
only so much you can do during surgery to make that happen. You do
100%.
everything you can.
Totally agree. You got to optimize your healing before and after. I think,
Sure.
especially with the face, that's like a big thing that you have to focus on. If you just do the procedure, you're not going to hit it out of the ballpark every time.
Yeah.
And if you want to increase the odds of that, you have to do preoperative and postoperative optimization. And there's a variety of ways to do
Yeah.
that with nutritional supplements, recovery protocols that I like to
Mhm.
do for my patients. Makes a big difference. It seems like this is
Yeah.
going to do anything, but it really
It
does.
does. I 100%. And I think that it goes back to that's why younger is better. Younger tissue just is
Right.
more oxygenated.
Robust,
It's
resilient, everything,
yes.
right?
Um, gosh, what was I going to say about the surgery or scars? Oh, I have 2 huge things. So I looked up like the most commonly searched surgeries per area for my age group.
Okay,
I think tummy tuck,
sure.
breast lift for Dallas, it was eyes.
Interesting.
Women in Dallas, they're wanting to
They
talk
want
about
their
the eyes
eyes.
all the time.
Okay,
Um, and then a big one was lip lifts. Those are increasing big time. I would always tell people the reason that I got lip filler to begin with was to increase the vertical height to decrease optically that philtrum, the length of the philtrum.
right.
It's one of my favorite reasons to get good lip filler is
Sure,
if they can increase that vertical height. But at the end of the day, as a makeup artist, when I do old age makeup,
sure.
there are certain ways, and now different ethnicities age differently. some
Yeah,
some get more jowling, so
right. Yeah,
so that take that into consideration. But one of the biggest things is that the lengthening between
it happens.
and we create a skinnier top lip that's kind of make it look like
Curled
it's
in a
curled
little
in
bit. Right,
to give them more length there, because
right.
a full lip or a thin lip in and of itself is not an indicator of age, but that length could
Sure.
be. And so I think now women are saying, oh, I see that. um Tell me a little bit about lip
Yeah.
lifts. Are they easy?
Well, at the end of the day, it's a straightforward procedure. It's a great standalone procedure,
Hmm.
but it's a great adjunct. And I do it more as an adjunct, actually.
Yes.
So I'll do it with my facelifts or facial rejuvenation procedures. Sometimes I'm doing it with a rhinoplasty
Yeah.
because it does kind of hand in hand go
Go
together with
together.
that. Sometimes I do it with the eyelids as well. If the patient's just coming in for their periorbital rejuvenation,
Hmm.
it's a great operation if done correctly and for the right
Key.
patient, right? Yeah, like
Yes.
everything in plastic surgery,
Yeah.
right? But you have to be the right candidate for it.
Yeah.
I think I get more patients who think they need it, and I kind of tell them
Yeah.
you probably don't need it.
Okay.
Versus, like you said, you do see patients who are, their aging lip, their lip has dropped, their lip has curled in a little bit, and they want more of their vermilion or their actual lip to show.
Right.
And the problem is if you keep doing filler and you don't have good tissue
Yeah.
quality, it's going to weigh down. It's just like a breast implant. If you have
Sure.
large breast implants and you don't have good skin quality, it's just going to weigh down.
Right.
You
And a
need
lip
a
lift changes the anatomy, whereas
right.
lip filler cannot.
True.
Lip filler
Yeah.
can really only make it bigger or smaller.
Right.
But like you said, you can actually have more show.
Have a little bit more
Um,
eversion,
right.
more show. It looks more natural volume.
Hmm.
You can do aspects of the corners of the corner lip lifts to also address for some patients who may have a little bit of a lateral commissure that's dropped. You can address that as well. And you can tailor it to the patient. I think doing it subtly is probably the best approach.
Hmm.
And then the question comes, can I still do filler afterwards? You totally can. You
Yeah.
just won't need the same amount of filler.
Yeah.
So patients who are like, I used to get a full syringe or
Whatever. Right.
you really just need a little bit just to highlight the lip,
Yeah.
and that's it.
And so it's hidden here, but what I'm realizing now is it's actually quite a long recovery for the lip lift.
So you have stitches in place for a week.
Yeah.
Stitches come out at a week. And then there's it's like any incision, early healing. I say by the end of a month, you should be at a point where things are pretty in a good place.
Okay.
It's faded. I start a laser protocol at 1 week. These are light treatments just to help that scar to fade and soften.
Yeah.
Scar gels go a long way. But I'd say by the end of 3 to 4 weeks, you're at a point where you're pretty
And
comfortable.
the talking, because sometimes it does kind of affect your speech. It's a little stiff.
You'll feel swollen and stiff.
Yeah.
That is true. And
Yeah.
that, like anything, will get better with time.
Yeah.
But there's a early swelling. Some patients like that swelling because it's like, wow, this is awesome.
I
Sometimes it
see I
goes
see it
away.
sometimes, and it looks a little funny. Can
Yeah.
address talking. Um, but is any muscle involved?
So different techniques. I typically do not affect the muscle because that is where you're going to have that stiff lip. Sometimes when you animate, it may look a little different. You may get some puckering. So at the end of the day, I like using the skin and the fascia above the muscle to really suspend and support the
Is
lip.
that something you can do under local?
You can do it in a local. So that's
Let's go.
yeah. No, it's
I'll meet you
actually
in there.
the two biggest procedures I do in the office are upper eyelids and then a lip lift.
That's great. And I
Everything
think
else I
that,
typically go to the operating room for.
yeah, but I think it's nice to have that option
Yes,
because,
definitely.
I mean, we don't always want to go under general anesthesia. I think that
Right.
can sometimes be a harder recovery than the
It,
actual
yeah,
procedure.
that's the half of the recovery, right? It's
Yeah.
just dealing with anesthesia.
Yeah.
And some patients, some surgeons like to do everything under local. Some have
Yeah.
like a blend. For
Yep.
me, I like the consistency, the safety profile with, doing some of these procedures under local, like a
Mhm.
lip lift, but then the rest in the
So
operating
you
room.
do all of your facelifts under general
I do under general
anesthesia.
anesthesia. I use really good board certified
I
cardiac
can attest to that.
anesthesiologists. So, they've been doing this for a long time. They do heart and lung transplants. So they're really safe. And
The best. You guys have the best
I'd
here.
say to you, just like any surgeon, no two anesthesiologists are the same.
Yeah.
And you have a procedure that you're doing, a facelift, and one anesthesiologist just knows how to fluid restrict, fluid manage the patient, control the blood pressure at the right key moments in the operation to where the procedure goes smooth and safe.
Mhm.
And it can go a very different way with a different anesthesiologist,
Yeah.
and that can affect your recovery. You can be swollen for a longer period of time. If the blood pressure is not managed correctly, you can get unwanted bleeding after surgery. These are things that I'm not saying it's all the anesthesiologist's fault.
No.
And I
Yeah.
know my friends are going to laugh at that,
Yeah.
but the truth is, you have to pick your
Yeah.
anesthesiologist well and trust them because that's half the operation as well.
So funny story. My grandfather was actually an anesthesiologist. So was my aunt.
Oh, wow.
My entire dad's side, they're all physician. My dad's an internist. The rest were surgeons
Sure.
and anesthesiologists. And when I was younger, I was going to go in, and my grandfather was going to be the anesthesiologist, and he was in his 80s. And I was like, I had to secretly tell the doctor, like, I I don't want my grandfather to like,
Yeah.
and he
Right.
was like, I got you. And
Yeah.
so
Yeah.
basically they had a friend do it, and I was like, I can't tell my grandpa
Yeah.
that
Right. How are
I
you going
don't
to do that?
want
How
him.
are you
And I'm
going to do
like,
that to
why
them?
is he
Yeah. Yeah.
still, you guys need to kick him out. And
Yeah.
I think they finally
Yeah.
did. I think he left at 88. He retired at 88 just
Wow.
because,
He loved what he did,
he
obviously.
loved what he did. He helped, I think, patent the way that babies are anesthetized
Oh,
today.
no way.
He was, I mean, he loved medicine, but I do think that they just finally had to kick him out.
That's awesome.
But he was great. He lived to be 99, so he still had a good
Amazing.
retirement after 88. But
I
yes,
bet. Yeah.
I really 100% believe that it
It's a
is the
big deal.
team. The
It is the
team.
team. It is the surgeon, it's the assistant, it's the anesthesiologist, it's your recovery nurses.
Yes,
I mean,
100%.
the
Yep,
first people that you interact with when you wake up are the recovery nurses.
100%.
Where you are, like, for our facility, like it's a very well appointed recovery facility
Mhm.
to where you don't feel like encroached, you don't feel claustrophobic.
Yeah.
You have one-to-one nursing, so one person is really taking care of you. They're not spending time with you and three or four other patients.
Mhm.
That is, in my opinion, that's what cosmetic surgery, plastic surgery
Yeah.
has to be about. If you're trying to just optimize that endpoint, I think you're missing out in the experience as a patient.
I
And
will say
it
that I've
it
had
personally bothers me a lot when I see that.
yes. I work the anesthesiologist that I had when I had my mommy makeover was like, just so comforting. He's like, I have kids your age, and
Yeah,
just like he really cared, um and that goes a really long way.
sure.
He called the night before. That doesn't always happen.
Super important.
The last surgery that I did, met one anesthesiologist, and then when I was going back, it was a different person, and I started to get anxiety.
That happens.
But I also have done surgery in like a dedicated cosmetic surgery center, and then
Right.
also had it at a hospital. And I'll never ever do that again. I didn't realize, like, I didn't think that it would make that big of a difference, and it does. A
Yeah.
dedicated surgery center that only does cosmetic surgery. It's just a, it's so,
Right.
it's coach in first class.
Yes. What we do in cosmetic surgery is not the same as all other surgeries out
Right.
there. And you're treating patients with a certain level of expectations. And there's a little also inherent anxiety to this. They're healthy patients. My patients are all pretty healthy at the end of the day, and they want to make sure that they're taken care of
Yeah.
and they enjoy the result afterwards. I think the biggest question I get when I sign up a patient for surgery is when they're talking to my team, they're asking about anesthesia. They're asking about, that whole aspect of the procedure. They're not so much caught up on the surgery, they're caught up on the anesthesia.
Right.
So, I realized early on that that's really important to really make sure it's delivered in the best possible way.
Yes, it is. It is. And I mean, that's why they have some of the highest
Yeah,
overhead, isn't
yeah,
it?
it's true.
Um, but I can definitely attest to your team. They're fantastic. Let's see. I think I don't. I think options for getting rid of jowls. I've done Kybella. It didn't work. Is facelift my only option?
Well, Kybella, I have an opinion about Kybella, but I'll tell you, Kybella in this area, I don't really recommend as much. So if you've tried that and you haven't seen the results, I would say if depending on what the rest of your face is looking like, sure, a face and neck lift would definitely help. Some patients may consider liposuction. If you have good skin quality, just doing a little liposuction, the gels could help, depending on how you look right now.
Right.
But when you just do liposuction, you're not addressing the skin. You may get secondary skin laxity. You may not like that pre-gel sulcus that you're
Yeah.
noticing here. And then you may chase that with a little bit of filler here to blend it. So there are ways to tackle that.
Right.
But at the end of the day, a surgery is really going to help
Yeah.
take care of that nicely for you.
I would say if you are in this sweet spot of maybe, 30 to 45 pushing it,
Sure.
and the skin hasn't fallen too much, you still have nice taut skin. I feel like filler in a strategic fanned fashion to disguise it. It
Yeah.
doesn't get rid of it, disguise it. And you also have to be at goal weight because filler it's augmenting, it's adding volume.
Sure.
And so you do have to be careful. You might have disguised your jowl, but now you've made your jawline heavier. So it's a very, very tiny sliver of people that would be a good candidate for that. But ultimately, if your jowling is because of fallen, is it fascia there, fallen fascia or
I think it's a
fat?
combination of volume loss here.
Mm-hmm.
Okay. And
Volume
then
loss here.
volume loss in the pre-gel area. At the end of
Uh-huh.
the day, also your mandibular ligament is also kind of relaxing.
And a ligament cannot be addressed
Uh,
outside of surgery.
Not really. I mean, you can try to like minimally like release it to get a little bit more redraping, but at the end of the day, to me, ligament surgery, I mean, that's a surgery. You
Yeah.
have to release the ligaments.
Yeah.
And then the jowl fat pads are like your nasolabial fat pads. They're stubborn. They don't really go away. Everything else
Right.
tends to go away,
And that's
except
why
for the
that's why Kybella probably doesn't work. It's a different type of fat, right?
well, Kybella is really basically like the enzymes that help digest fat in our food. At the end of the day, it's really that. And you're injecting it into the fat, classically in the neck, but in the other areas of the face. And you're allowing that enzyme to dissolve and digest that fat. And then you're allowing your body to kind of basically eat it up. It's a cell called a macrophage that will kind of come in and eat up that fat essentially. So it's a long process. Who anyone's that had it that knows they've had Kybella, it's swollen, it's painful a little bit. You're red,
And
it's the process, but
it's
100%
not exact either.
no,
Like,
right?
because you don't know, where is it gonna dissolve at? Is it going
Right.
to fully,
Exactly. And then my pet peeve, injecting in some high risk zones is there are nerves there, and the lining for a nerve is also like a fatty tissue. And so
oh,
if that injection gets in the wrong areas, you can have some nerve damage as well. So
interesting.
so you got to be careful with Kybella,
Yeah,
realistically. I think it's really meant for the neck because it's a somewhat safe zone. But even there, you don't get sometimes you don't get the best results there.
yeah.
And you have to do it multiple
And
rounds.
isn't some of that fat kind of hidden at the neck underneath the
Yeah,
muscle part of it?
there's deep neck and there's superficial neck fat. When we're doing a neck lift, like realistically, you want to address both, but you want to carefully preserve superficial fat because that's what's giving the integrity to your skin.
Well, and that's what I mean, when you get lean, like, that's when you start to see, like,
Right.
all of
You see
like, you
all
see
see
that's
what's
why everybody
happening.
tells me I have an Adam's apple, which I do, but everybody does. That's why you can see mine more because it's just
You
lean.
start seeing more. Yeah,
Yeah,
exactly. So you want to carefully preserve that. If you get liposuction there, you're just removing a lot of that, and then you
yeah,
just have skin on muscle, and that doesn't look great either.
yeah,
So
tell me about
yeah,
it.
you can get there naturally, or you can get there unnaturally.
Yeah, and to your point about needing multiple treatments of Kybella, you will pay for liposuction in the end. I tell people it's kind of like I'm gonna try to dye my hair out of a box, and then you end up going to the salon anyway, and now you've paid more
Exactly.
to fix the
Yeah,
damage.
I think
And
sometimes you have to pay more to get the result that matters.
the one that's like it's exact, right? Like
Yeah.
you see
Yeah.
those games where they put the paper on the head and you have to like draw the picture. It's
Sure. Okay.
anyway,
Yeah.
that's how I felt Kybella is. I was like, I don't know. Or you can have sit down and
Right.
draw or trace,
Yeah.
which is the
I
surgeon
yeah, I
doing.
think the classic comparison for Kybella is liposuction. I mean, it's like one or the other.
Yeah.
And some surgeons like, seeing a patient a couple times
Yeah.
and doing the injection, and they like that too because it's like, well, I'm not having a procedure, I don't have to go under or have this whole recovery
It's
process. But
actually so easy though. Just isolated neck
yeah, I would agree.
lipo.
I think it's really just really explain to the patient what is the whole process going to look
Honestly, you
like.
will look so much better. People after Kybella look like bullfrogs.
You do. There's a recovery process for Kybella too.
Yeah, like,
So,
I'm like, you can just wear, like, a little chin strap, and in
right.
a week, you just
Sure. You have
might not
to
even have a lot of
you
bruising.
have to do enough of it and you have to do it a couple times to I think
Yeah,
see the result that you're
yeah.
looking
No,
for.
I'm 100% with you on the Kybella. This is so neat. I think
We
we
should do
need
it
to get
again.
more. Yeah, we need to do this again, and we need to get more before and afters so everybody can see
Yeah, I would love that.
working on
Yeah,
that.
for sure.
I just think it's so helpful, when we get to see. I think we've been empowered as consumers, and so now we can know, like, really what we're getting
Yeah,
into.
and that's the best part is like now patients are fully informed.
Yeah,
There's no like question as to what they know and what they don't know. They come in with a lot of questions and I
right.
encourage that. I'll spend 20, 30, 40 minutes, whatever it
Absolutely
takes,
do.
answer their question. I'd rather have 10 questions than no questions
Right,
because
and
then
uh,
they're getting it
100%.
or they're
That's what
thinking about it.
drew me to you. Is I just kept like I feel like if I were in your shoes, I would be annoyed. You never were annoyed with me, or like,
Yeah,
yeah, I didn't
I
feel
would
annoyed.
rather the question happen before surgery than after surgery
Yes.
because after surgery, surgery's done.
And what I appreciated was, and I've been to a lot of consults for a lot of different things.
Sure.
And when I met you, even with like breasts, for instance, you can have five people with five different aesthetics. They will all want different things.
Right. So true.
And you really taking the time to grasp what I wanted my breast to look like. And I hadn't, I mean, I've had four surgery. Like
Right.
it took
Yeah,
a
you had
long
a
time.
journey. You had a long
And it was
journey.
like, okay, listen, this is what I want. And you delivered. And that was because there was no like, no, 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 no. I know exactly
Yeah.
what you want, which is kind of
Right.
what I felt like I gotten in the
Yeah,
past.
you can't I think, there's different ways to treat and handle patients, and I think it ultimately always comes back to what does the patient want,
Right.
right? It's not what I see, it's what you see.
Yeah.
I think that's the first thing that matters. Sometimes the problem is patients don't know what they see. They don't know what they want. And that's half the
Yeah.
conversation is educating them on how to look at yourself and tell me what bothers you or what do you want to see.
That's a
And
big
those
one.
patients I think aren't ready for surgery. That conversation happens early on and They have the consult and they come back a couple months later saying, okay, I thought about this. But
Yes.
someone like you that knew exactly what you wanted and now had questions, that's perfect. That to
Right.
me, that is the ideal consult.
And to your point, I might not have known what I wanted to begin with until got what I didn't want,
Yeah,
and because my initial surgery came with a lift,
right.
it was just kind of like, well, we're just going to lift things back into place. But then the implants are such a separate story.
Right. What gets me is the patient that tells me how to do the operation. And that's where I'm like, okay, we have to really have this like transparent conversation
Yes.
here is, it's a longer conversation because it's like, if you did it your way, here's what would happen. If we
Yes.
did it the way I'm suggesting, here's why I'm recommending it and here's what I'm trying to avoid. And,
Yeah.
and in most cases they get it, but
Yes.
it's how much information they get sometimes, right? Or it's basically the patient that's gone to more than one consultation and they're hearing three different approaches, which is very normal,
Yeah.
unfortunately.
Yes.
And they're just trying to make sense of it all. And
Eh,
I don't get annoyed by it because
No.
it's like, what do you expect? Like the patient's gone around for three surgeons, had this real problem sometimes, or it's their first surgery, or it's
Yeah.
their second or third, and they just want to have this problem fixed, but they're getting like different opinions and
And I
trying to make
think
sense of
there's,
it.
yeah, right. Like you have to have a relationship with your surgeon. Like you have to feel very comfortable with them, but you also have to have a level of trust that's saying like, hey, you've gone to like a lot more school.
Yeah.
Like you've done this.
Yeah.
You've
Trust.
actually done the surgery.
Right.
But I'll tell you to your point, when going to look at a tummy tuck, I thought that I knew exactly what I wanted going in. And I was like, I don't want drainless. I don't want this and that. I ended up, the surgeon that I ended up picking, he did do a drainless procedure. Now, I wasn't happy with the scar at the end, but the way that he explained the surgery and why he did drainless
Right.
made total sense to me. He was super comfortable with that. He glued down the skin.
Right.
It was his technique, and I'm very happy.
With
I
the
was very
results.
happy
Sure.
with that. It was nice. But then there's other surgeons that they tell me, okay, I use a drain because of this, and
Right.
at some point I did have to let go of my preconceived notion of what it should look like and
Sure.
really trust that you're doing this in a very, very, very different way. When clients ask me, do you use an airbrush machine to do makeup? I'm like, I don't. My tool of choice is my hands, a brush, a sponge. At the end of the day, I feel like I get a better, more realistic result with that,
Right.
because even after an airbrush machine, I would still have to manually go in because I consider the face like a topographic map, and it doesn't all need the same layer of foundation
Yeah.
over every place, and airbrush will do that. That is my choice. I've seen artists that use an airbrush machine and it's beautiful. And if that's what
That's
if
a great
you go to
analogy.
them. And so I know that that's like so like
It's
not
true though.
comparative, but
It kind of is actually. I think there's a lot of similarities with what you do and what I do in that sense is, you have a client and you're trying to get them to an endpoint,
right.
right? And you're using what you know works for you.
Right,
And
it's my skill set
right.
to get to the end point, and it's perfectly okay for the person to say, "But this is what I want," and I can say, "Then I'm probably not the artist for you. I am
Yeah.
not as skilled or comfortable with that machine to where I feel like I can give you that result better than how I have trained."
And that's a real conversation there, right? I
Yeah,
mean,
and that's okay. I think
that's okay.
being really truly comfortable in what you do is
Yeah.
being able to say like, we're not on the same page,
Right.
and I might not be the person for you, and that's okay. um that doesn't mean I'm a bad makeup artist, or
No.
you don't know what you're talking about. It
Right.
just means like we're
Yeah.
probably not right for each other.
It's a match,
Yeah,
right? A
it's a
patient and
match.
surgeon, a patient and artist, or client and artist. It's
Yeah,
a match at the end of the
yeah,
day. And sometimes that's not a match. It shouldn't happen.
yeah.
Because if you're not on the same page before, you're not going to be on the same page afterwards. And that's when
Yes,
it gets a little
I
rocky.
will tell you from my experience, like, I feel like I'm like, in my head, I'm like, "You haven't had that much," and I've had, like, a ton of plastic surgery. Like, "Have you had a lot?" I mean, yes, I have. Um, the aftercare is so important, and the reason why again and again can tell people, go to see you and your staff is the aftercare is unmatched. Your willingness to listen when we're having down, like a bad moment, or feeling like we need a little security from you, or excited, whatever the case may be.
Sure.
It truly is unmatched, with all the surgeons that I've been
Well,
to. It doesn't mean I've gotten poor results.
no,
Don't get
you've
me wrong, but like, that is critical to your mental health in
it is.
addition to that, because surgery does take a
I
toll.
think your mental health is actually a very important part of the recovery.
Absolutely.
And, other than just being the surgeon, along with my team members, like my staff, like we're here to make sure that you're taken care of in
Yeah.
all regards, not just your incision or your recovery or swelling, whatever it may be, but
Mhm.
also your mind space, your headspace. Um, a happier patient, a more calm, you know, taking care of patient will recover better than someone who is nervous, scared, unsure about what's
Yeah,
happening.
that's so true. And somebody that is kind of prepared for the highs and lows after surgery.
And they happen.
And they
They
do.
happen.
They
Even the
do.
most confident patients that I know I want this, this is what I want. They come in, they have the consult, they sign up for surgery. Even they sometimes have moments during the recovery where it's like, did I do the right
I
thing?
fully prepare myself every time,
Yeah.
and my family, to say
Right.
like, you're I'm going to question this.
Right.
Don't freak out.
Who's
You
yeah.
guys have to be, we are all in this together. A spouse is very much a part of your recovery, and having somebody that's supportive and somebody
Who's
that's willing to see you maybe cry it out for a little
who's
bit.
going for the ride with you, right? Like that's
Yeah,
really important
it is
because
very important.
they have to also have that endurance to kind of go through it
Yeah.
with you.
Yeah,
Super important.
I
Yeah.
agree. I
But
agree.
yeah, I really empower my team to like really like make sure everyone's taken care of in that sense.
No, you have a great team. You
Otherwise
have a
it it,
fantastic
it
team.
doesn't work out.